Hi, this is Dr. Luthra. Welcome to Urgent Care of Westchester. This practice was open to meet the urgent care needs of this part of Westchester. There was no existing urgent cares, and we were one of the first ones to come into this business.
Whether it's cold, simple things like colds, flu, to injuries, and we do x-rays, sore throats, urinary tract infections.
We got into OmniMD about 5 years back to provide better documentation and better billing, and just to enhance the whole medical practice and make it easy for the providers, for the patients, for the hospitals. We had looked at a few providers even back when we started with OmniMD, and the best thing we liked with OmniMD was the flexibility and their ability to make the changes according to our need. A lot of features which could be, we could adapt for our urgent care needs, because the bottom line is most of these softwares are geared towards primary care. Okay? There are very few, even at this stage, which are solely for urgent care. So every software that you go to, you'll have to make some changes to adjust to the urgent care needs. And OmniMD was able to meet our needs, and we've had a good experience. If an EMR or a EHR has a good billing component, it definitely helps the practice, because that's one area that a lot of these practices, and that's the number one reason that they will fail, is if they're not able to collect all the money. So if you have a software which allows us to, find out ahead of time if this patient has this deductible, or this is the copay, and be able to collect it, and then on a later stage be able to send out bills in a proper fashion and be able to collect. Yeah, there's a lot of ways that a good EHR can help with billing and the practice. Yeah.
Omni's very user-friendly. It's very easy for the office staff to see patients, sit down, enter their vitals, and move on to the next patient. Everything regarding patient information is fully documented within the patient chart on Omni. So it makes it very easy to track conversations with patients regarding their important results and follow-up, so that we don't have the same doctor on staff every day. The doctor who's here tomorrow can see what the doctor today said regarding patient information. Keeping records in Omni actually helps us maintain increasing patient load. We have 4 providers on staff. We have 3 MDs and a PA, and we also have an MA staff of about 5 and a few x-ray techs. Omni keeps us connected from anywhere in the office. Anyone can access the information from the front to the back to the doctor, so everyone's on the same page as to exactly what's happening with each patient in the moment.
They are always there, and since OmniMD is local as far as we are concerned, and for most of our practices, that's very helpful that we're not talking to someone that we haven't seen.
It's actually very simple to use. It's very convenient as far as time goes. It's easy to just enter items and click, rather than having to write and keep bulky paper charts.
Instead of looking for paper charts or looking for information in the patient room, it makes it very efficient, cuts out the clutter, and makes things flow very smoothly. We are able to move patients very quickly and see them with very little waiting time. I find OmniMD very valuable in tracking patient payments. Accounts receivable being one of the most critical aspects of a business, which is very easy to track using 2 or 3 different ways, either based on the insurance, based on patients. There are many different ways to sort of sort the data and look through it to find accounts payable, how much balance is outstanding, how many payments have come in, and this is all real time, more or less. As long as we enter the information on time, that data is very easily accessible, gives us a very clear shot of where we are in terms of collectibles or outstanding payments.
We look forward to providing your healthcare needs. Thank you.